Hello, my name is Jelly Nicole Polanco Martinez, Chapter 33, the urinary system. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it is passed or voided. Patient may say, I had some pain when it passed greater P. Doctors may say, are you having any trouble with your water course? Doctor, are you having any trouble with your water course? Mr. John, well, I do seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones, it depends, but sometimes it's every hour or even more often. Doctor, what about at night? Do you have to get up at night? Mr. John, yes, nearly always 2 or 3 times. Doctor, do you get any burning or pain when you pass Weddell? Mr. Jones, no, not usually. Doctor, do you have any trouble getting a start? Mr. Jones, no. Doctor, is the stream normal? I mean, is there still a good strong flow? Mr. Jones, perhaps no kid should go as it used to be. Doctor, do you ever lose control of your bladder? Any leaking or dribbling? Mr. Jones, well, perhaps a little dribbling from time to time. Doctor, have you ever passed blood in the urine? Mr. John, no, never. Common urinary symptoms and their definition. Frequency, frequent passing of urine, dysuria, burning or scalding pain in the urethra when passing urine, nocturia, urination at night, urgency, urgent need to pass urine, hesitancy, difficulty starting to pass urine, urinary incontinence, involuntary passing of urine, hematuria, macroscopic blood in the urine, urinalysis. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with RAGE Street, for example, clinics tests for the detection of glucose. More delayed tests are carried out in a laboratory on a specimen of urine. Typical specimens are a midstream specimen, MSU, and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or CATs. CATs are solid bodies formed by protein or cells. Plus SEMs are used in cast note to indicate a normal findings. A small amount is described as a trace. For a large amount, the word gross or marker can be used, for example, gross hematuria. When there is nothing, the word nil is common. There was no sugar, a trace of protein, and gross hematuria. Look at the conversation in a opposite and complete the notes above Mr. Jones. Use medical tests where possible. CO frequency and nocturia for 1 year. No dysuria or hesitancy. Extreme, a little weaker. No incontinence apart from occasional dribbling. Match the patient description of their symptoms 1 to 7 with the medical terms A to G. Look at A opposite to help you. 1. I have to pee every half hour or so. 2. I get a scalding pain when I pass Gradle. 3. I have to get up several times to pass Gradle at night. 4. I have to rush to go to the toilet. 5. I had trouble getting start. 6. I can't hold my Gradle. 7. I paste some blood in my urine. A. Dysuria. B. Frequency. C. Hematuria. D. Excitancy. E. Nocturia. F. Urgency. D. Incontinence. 1 is B, 2 is A, 3 is E, 4 is F, 5 is D, C is G, 7 is C. Write the doctor question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. Dysuria. Do you hate pain or burning when you urinate? Frequency. How often you urinate? Hematuria. Hate you urinate with blood. Hesitancy. Do you have any trouble getting started? Nocturia. Do you hate to get up at night? Urgency. Do you feel an urge to urinate? Incontinence. Do you ever lose control of your bladder? Describe the findings of the laboratory report in words. Look at B opposite to help you. Blood protein cats. There was a trait of blood, gross proteinuria, and no cats.